This is the Kickasspirational Podcast. We're live today with my brother-in-law, Joe VanderMeer. It sounds like Vanderveen, but it's got two different letters.
Yeah.
Vanderveen means from the swamp, I think, or peat bog, and VanderMeer,
yes.
yeah, VanderMeer means from the lake. So
Yeah.
you guys we were upstream from us apparently, or maybe downstream, upstream. Yeah, the lake flows down to the peat bog, I guess.
Yeah. Yeah, we actually went 2 years ago, we went to the Netherlands, and there's a guy there who's sort of peripherally related to us.
Yeah.
And he was, for a long time, he was an attorney in the Netherlands, and then he was an ambassador to one of their sort of island nation provinces or whatever. And then he worked for their, what kind of would be their Department of Agriculture. And then he retired. Nice. Red 6.
Red leader. It's Porku
Red
Jenkins.
leader.
That's my workout t-shirt.
Right.
It motivates me not to become Porku Jenkins, but keep going.
That's right.
Keep going.
It's good you got Canute to keep you from doing that, man. That'd be terrible.
I don't want the COVID-19 to become the COVID-20. What
So this guy retired and he started doing genealogy. So we went, and my whole family went, and we actually went to Holland, which is the city in the little province of Friesland that my grandpa grew up in. And we saw the church where my great to the 5th power grandpa was baptized and married. And the little plot of land against a body of water, which was what he owned in 1815 when Napoleon said we had to have last names. And we became VanderMeer.
Because you're from the lake.
Yeah. Well, it really turned out to be kind of a glorified irrigation ditch. It was not.
Welcome to Friesland.
Right, exactly. It was not impressive. In fact, I think my 8-year-old niece looked at it and she goes, "I'm underwhelmed."
Yeah. Well, we did so both of our families are, at least half from Friesland, right? And which is why our children play the banjo so well.
Yeah, indeed.
Right? Yours and mine. But because Sarah's family's half Frisian, my dad's family is Frisian. Are you guys 100% Frisian or half Frisian, or what's your percentage Frisian?
My mom's family is from Groningen, and my dad's family is from Friesland.
Okay, Groningen.
So Groningen is just a little northeast of that.
I should probably put that in context for people. There's the Netherlands. There is a province called Holland where Amsterdam is. My mom came from Zeeland, which is south of Holland, another province. If you go north of Holland across the Zuiderzee, you run into mostly Friesland. It's a little bit of, there's another province just over from it that they retracted from the water not that long ago, but it's mostly Friesland. And then if you go north of Friesland, there's Groningen, which is a small, not very small province. And the Frisians still speak Frisian, which is like the only medieval language still spoken in Europe. I think it's like Angles language, basically. It's like Old English, but from a Dutch person.
You got to have a computer mug to speak Frisian.
Isn't it weird?
Like odd.
It is. So I wanted to, so we have some history. You married my sister. You're still married to her. God bless you. No, I love my sister Jane and our family. But tell me about, I thought it might be interesting to talk a little bit about, you're an ear, nose, and throat specialist like my father.
Mm-hmm.
And you practice in West Michigan. You and my dad practiced together for a little bit. Tell me what's going on right now with COVID-19, maybe in Michigan and in West Michigan where you guys live, and how it's affecting your practice and what you're doing.
Yeah, so in Michigan writ large, it's primarily in eastern Michigan, in Macomb County and Wayne County. Overall, within Michigan, that's basically the Detroit and Detroit suburbs.
Right.
I think overall in Michigan, there are maybe, I want to say, 18 or 20,000 positive cases. There are on the order of 800 or so. Let me see here. I want to say it's about 800 deaths in the state of Michigan.
Okay.
There are in West Michigan, and specifically in Ottawa County, which is where not the province of Holland, but the city of Holland, Michigan, is where I live.
Strangely, a lot of Dutch Americans living there.
Isn't it though? That's right.
It's like the Dutch American movie, yeah.
Exactly. So I think that we have 56 positive cases in Ottawa County, and there have been no deaths. Grand Rapids, which is in Kent County, which is sort of the bigger West Michigan city, I think is on the order of several hundred cases with maybe a dozen or two deaths. So it's clearly within Michigan, primarily from the Detroit area, and then it's kind of spreading out from there.
How much testing are you doing?
It's still quite limited. I think as of either today or yesterday, they revised the state guidelines as to who could test or who would get tested. I think that the change was primarily in that now they would open it up to anybody they call essential work. So that includes anybody who's got a job that is grocery store stockers and clerks and cashiers and delivery people, anybody that's kind of maintaining the food supply and so forth, healthcare workers, all of those people are now open to more consistent testing. But my feeling is that testing is still woefully limited. I don't know that we have any official estimates, but sort of, back of the napkin estimates by physicians I know are that something like about 10 times the number of diagnosed cases are currently within the community.
Right. Well, and I think like here in Laguna, we had early testing. One of the private medical practices had tests and was offering kind of drive-up testing, so a kind of a socially distanced test. And this was like right at the beginning, like before there was even a lockdown or quarantine. And the interesting thing is, so we've had a lot of testing in Laguna. So we're over-indexing in the number of reported cases because obviously we've been testing people. Like we have more cases than Irvine, or we did have more cases than Irvine or Anaheim, which are much bigger cities in Orange County. But also we tested 10 times as many people. So it's kind of there's a correlation or indirect correlation there. But so I think that's really interesting. But you're not seeing, so the hospital's not being overwhelmed right now, and
no, and I think, a big part of that is just who gets hit first. In New York gets hit first, right? It's a big international hub, and it's an incredibly crowded and powerful city, and
it's where a lot of Europeans are going to hit U.S. too, right? That's
right, and it gets hit before any of the scariest stuff happens, right? So there's a whole thing, all these comparisons to the flu virus of the Spanish flu, the 1918 flu.
Yeah.
And the comparison of Pittsburgh or Philadelphia and St. Louis. And a lot of people have kind of made this, St. Louis did all the right things and Philadelphia didn't. It really is just that they got hit at different times.
Yeah.
And the virus was really raging and rampant within the country by the time St. Louis was really affected, and they had already shut down. And there were probably some details about, public health responses as well, but clearly New York gets hit before the restrictions are all in place. Clearly Detroit gets hit first. By the time Macomb County is on the upswing, we've already shut down, and so we're not having anywhere near the transmission.
You also have a smaller population that's more spread out, and that's also probably more compliant, right? I'm assuming when you see something bad happening in Detroit, people in West Michigan, there's going to be a different level of response in general. There's people.
In Italy too, Italy was running out of places to put the coffins. They were running out of coffins. By the time it hits Detroit, there are real examples of how bad this can really look.
Right. No, it's interesting. We were sharing some articles that we were reading, and just to put in perspective, that you went to medical school. You did you went to University of Wisconsin-Madison?
I went to Calvin for undergrad. I went to the Medical College of Wisconsin in Milwaukee for medical school. And then I went to Johns Hopkins for my ENT residency.
So, you're a real doctor. I'm not going to make jokes about people who call themselves doctors that maybe wouldn't put in the same category, but you've gone to real medical.
I'm a medical doctor. We'll see.
Real medical doctor. Yeah. So, and you've gone to Johns Hopkins, one of the best schools for ENT in the world. So you're not just, you've got some real authority to talk about these things. We were looking at some of these articles and talking about some of the criticisms of, different groups. Obviously, China is run differently than the U.S. is. You've got a World Health Organization that is more like the UN of medical knowledge, and has a lot of it has a lot of politics, but it also has I think, I don't think people are intentionally trying to hurt people. What are some of your thoughts about criticisms, concerns, things that were handled poorly, things we could have done better, and what are some of the best practices that maybe you're thinking about right now?
Yeah. So the first thing I'd say is I don't have a public health degree. I'm not a virologist. I'm sort of an armchair political junkie. So,
but you are the head of the physicians group in your practice, in your hospital, right?
Yeah. I'm the chairman of the board of our physician hospital organization. And we've had some part in responding to this. I'm sort of in various positions of leadership within the hospital, so I have at least some connection to the people who are guiding that response from the hospital standpoint. I think in terms of how we locally, so I mean, I guess there are like 4 levels of response for me personally. And the first level is just like, have I got food for my family? What are we going to, do we have enough cash on hand? That's just like the first day that they shut down. Have you got that stuff? The second one is my office. Like, what am I going to do to take care of people? It's none of the things that I do on a daily basis stop happening, right? I mean, I've been booked 6 weeks out for a year, and all of those things are health problems. Granted, most of them are kind of quality of life problems, but what am I going to do about the 80-year-old people who they're still getting dizzy? They don't stop all this because there's a public health emergency. So how do we manage that while still protecting myself, my partners, my office staff, protecting the 80-year-old who's going to come into a healthcare facility? That seems like a horrible idea. So a lot of it was standing up video visits, telephone visits. How do we deal with payment? How do we try and keep our employees on? How do we make sure they're safe and we don't lose that? I mean, there's a huge amount of knowledge base that we really need. So that was kind of the second phase. The third phase is, what do we do as a community? And a lot of it is just a lot of social distancing, a lot of, trying to communicate with everybody I know, and have the physicians in the community talking with their patients about this. I mean, like when I do video visits, I'll talk to people about their ear infections or their, whatever. But my last question to them is always, do you have any questions about the virus? Do you have any questions about why we're doing this, what the response is? And that's kind of what our job is to help people understand why we're doing it.
Do you have action plans that you're putting together for your patients or for your family? I'm sure you do for your family, but you want to walk us through some of the action plans? Like, here's how we're going to manage this. Here's how we're going to behave. Here's how we're going to change our life right now.
Yeah, I mean, most of it is stuff that you post a lot about, like how to socially distance, how to stay active, how to do things to stay healthy. Most of the action plans we have, because I mean, when we're talking about a virus, almost our entire response, our entire treatment regimen is public health, right? I mean, we don't have a virus vaccine. We don't have live virus attenuated versions. We don't have any way to prevent this other than not to get it. All of the treatments that we have, all of the studies are being done about medicines to use and ventilators and steroids and all this stuff. It's all treatment after the fact, which is functionally just supportive care to keep you healthy enough so that your body can fight it, right? So in terms of action plans, I mean, for us in our office, a lot of it is just ENT is not generally one of the front line. Hey, how you doing, Sarah?
Oh, sorry. I hope this isn't a real podcast.
It is a real podcast,
sorry.
But it's okay.
Sarah's,
this is my wife, Sarah. If you're listening instead of watching, my wife, Sarah, just came in. She loves my brother-in-law, and she wanted to say hi.
Who doesn't love Joe?
Everyone loves Joe.
We call him Super Joe. He's a wonderful
I call him Mini
brother-in-law.
Ted because he looks more like my dad than I do.
Not really, but I might act like him more like him.
No, I'm joking about that.
I'm really sorry for messing that up, but we miss you guys, and
we all look alike because we're all.
Oh my gosh, that should be said. We actually would be, were it not for this terrible, terrible disaster, we would be surfing right now.
Here.
You would be here, and we would be surfing together. And I'm so bummed you're not here. We had such a cool zone. We had a really cool rental house lined up for you. But
yeah.
you can always stay with us, of course. But we had a really cool zone lined up.
We've got that zone, yeah. Since we've been doing the home, all the home.
This is half the fun of a podcast now. Is when I'm doing remote podcasts, usually it's because I'm on the road or something. Now we get Sissy.
We've got like
special co-host Sissy.
Now I just bomb his podcast like all the time.
Nah, that's fine.
You could be like Andy to my Conan.
Exactly.
Right. Either that, or you could bring some sanity and some stability.
No. Sanity. She's the straight man. Yeah,
that's right. That's right.
Like, does that mean the gay man? I guess so. Yeah.
Well, anyway, Joe,
you
and Jane, love your boys, miss you guys.
And what we should do? I should start co-hosting with Bert Dirksey.
Oh my gosh,
that'd be Kick-aspirational.
That would be truly Kick-aspirational. Right. Okay, that's a follow-up to this. So we're talking about the plans that you're doing. So you guys are following most of the standard action plans that we've talked about, the hygiene, sanitation.
So ENT generally is not a huge frontline provider for this. I mean, really our only role in this is do people need to have breathing tubes put in, and are there not enough physicians who normally do that, like emergency medicine physicians or anesthesiologists or hospitalists?
So you would assist with ventilators and things like that if you needed to.
Yeah, we have not been called on to do any of that stuff. The only other thing would be, are we involved in putting in tracheostomies or something like that? That we're not, at least in our community, we have not been involved in that. Those are all fairly risky procedures in terms of this virus, because they tend to aerosolize a lot of secretions and people get very sick. And if you look in Wuhan and the data there, for instance, I think I can't remember the name of the guy, the whistleblower, Liang, I think was his name.
This is the doctor who first started seeing the cases, and finally
he was the one that first, like, he posted the message to his medical school classmates and then got punished for it. He was an ophthalmologist.
Oh wow, doctor.
And it's so people who are putting their face right up in front of other people. So that's kind of why, for the most part, our office is shut down. I mean, unless you have an active infection, active bleeding, or a growing tumor, you really don't need to be seen in our office.
Right. And you're doing a lot of like tonsils, adenoids, hearing aids, inner ear surgeries.
Yeah, my area of expertise is ear surgery. My partner does a lot of reconstructive surgery for reconstruction of like facial plastics defects. And then my other partner does a lot of endocrine surgery, so thyroid and parathyroid surgery. And then the rest of it's kind of nasal surgery, sinus infections, nasal obstruction, that kind of stuff.
Got it.
So
what are you guys doing? How are you? You've got two boys, my nephews. What are Jonah and TJ up to? How are they staying? They're in junior high and early high school, right?
They're both. It's 7th and 8th grade.
7th and 8th. I'm sorry. I was thinking Jonah was in high school, but so he's early teens.
Going into this is the 3rd or 4th. I think we're going into the 4th week. This is the 4th week of them off school. We're losing our minds. No, I mean, a lot of it was.
Are you self-medicating?
Oh, yeah. Well, this really is not a vacation, but I always feel like on vacation, the 5 o'clock drinking time, it's very fluid.
2 is like 5 if you flip it upside down.
It is. It does look very similar. So Jane actually, I think, put a little kibosh on that, because I ran through a whole bottle of a Kirkland bottle of vodka. And she didn't refresh that for me.
We've been pounding, I don't like to admit this. Sarah and I didn't really even know what White Claw was until last fall. Sadly, we ended up in Green Bay, Wisconsin, and thought the only thing we could buy after 9 was White Claw, because we thought we were getting away with it and the clerks didn't know it was alcohol. So we ended up drinking, of all the places to discover White Claw, Green Bay, Wisconsin, where we should be drinking, the champagne of beers. And anyway, so we kind of fell in love with White Claw because, it's low calories, easy to drink. We kind of put the kibosh yesterday on like how many White Claws per day we should be drinking, because it's like, I feel like I'm just hydrating. But
the world's going to run out of aluminum at this rate. Yeah.
Oh.
So yeah, I mean, probably the broader thing is protocols. So basically any hospital that has that accepts Medicare payment has to have an emergency response team. And they have different names for them, but basically you have to have a team that is ready to stand up some kind of multi-pronged response to emergencies, be it natural disaster or, I mean, obviously a hospital, it's primarily going to be an infectious question.
Do you guys have a cool name for yours? Is it like the Super Adventure Club or something awesome?
I'm not going to tell you. That's the one thing I can't tell you. No, I don't know. I mean, I'm actually not on it. It's mainly administrators, because again, so much of it is public health. Like, how do we put the appropriate number of masks in this spot? How do we take the appropriate number of employees? And actually, I would have to say Holland Hospital's response has been remarkably coherent and effective. They have maintained basically all of their employees and just deployed them in different ways. So, for instance, I was walking into the hospital to do a consult on someone the other day, and one of the speech therapists who I oftentimes work with was manning a temperature station to take my temperature when I came in. And
was it, did they do it anally or orally?
Never mind. It's a temporal artery probe. Thank you very much. It's not an anal probe. That would be more accurate, though. I mean, if you're really looking for accuracy.
Bend over, Dr. Joe. We have to take your temperature. I'm not falling for that again.
So they have a 4-phase plan, and we're still in phase 1, which is basically just like clear out the hospital, make sure that we're ready for patients when they come in, and it goes the gamut up to phase 4, which is like there's a tent out in the parking lot with beds and ventilators in it. We've looked at one of the area senior homes that has. It's actually not like a nursing home. It's a senior activity center called Evergreen Commons, and they have a number of rooms. And I'm not kidding, man. It's
a
awesome.
Great name.
Yeah.
Evergreen.
So they have a whole plan for how they could turn that into overflow beds, and it's just down the street from the hospital. So there's a lot of creative thinking about how to try and manage that if it were to happen.
That's great. No, it's great to be that proactive. And I mean, I think, our president has had mixed reviews on his response. He gives himself very high marks for cutting off the China travel early, which I think was probably, hindsight probably wise. But guessing about when it might be over, maybe not the smartest strategy in hindsight, or with foresight.
I actually, right. And with complete lack of information. The thing is, I think that I actually got into a discussion with my neighbor the other day, and he's a smart guy and a really nice guy. And I was really quite taken aback when he said, "I think he's doing an amazing job." And I thought, I have not heard somebody that I respect say that out loud. Like, it did not occur to me that was a belief that you could hold and still have a brain to hold it in. And so
why so why did he think that? And what was the foundation? I'm curious. I'm kind of, at this point, I'm kind of done arguing with people who have beliefs that are hard to substantiate, like whether or not, bats are being weaponized with 5G and chemtrails. I'm just really curious. I'm just really curious why they think that, So why did he think that?
Well, so I have been very hard to believe that, regardless of this public health emergency, there is going to come a time when this presidency ends, and we're going to have to be able to have a conversation as if we're, all Americans, and we have a commonly held set of beliefs. And if we alienate everybody by telling them that they're so stupid that they can't possibly have value, that's a really big problem. And to his credit, he was quite. He just said, "Look, I think we're just going to have to agree to disagree." I think that in that vein, I went and did a bunch of reading about what was the response and what was the problem with our response. What did we do right and what did we do wrong? I think that getting into the details of what he said is a fool's errand, because what he says is so inconsistent that it doesn't make sense half the time. I think that when he reads and I'm talking about Trump here, but when he reads a prepared script, you can be sure that at least half of it is right, and other than that, I'm not sure. And so I guess to a certain extent,
but do you know which
half? That's the problem. That is a huge problem. But I think to a certain extent, the key is to figure out what is actually happening, because one person sets a certain tone, but that's a massive institution and a series of different institutions which are supposed to implement policies. So in search of some rational explanation for it, it's very hard to look at one thing and say it was all bad, or it was all good. I think that of the things, so I'll start with the list of things that were done well, which I think is a short list, but the closing off travel from China in mid to late January was a reasonably good choice, especially looking back. Now, you could make the argument that that's kind of like congratulating a pig for oinking. Like that is his baseline belief, is that we should close borders with people we don't like. So it wasn't a huge stretch for him to do that.
It was just a reason to close it off. He wanted to close it off. Right. It was just a reason, right?
Right. So it makes sense that he did that because he really wanted to. He didn't close borders with Europe until late February, right? And by that time, it's in Italy, it's in Spain, France had their first case by then. Germany. And there are many more people coming from Europe than there are from China. So, but that is one thing you could make an argument he made a good choice. I think another good choice is the Azar, the HHS secretary, declared the public health emergency in late January, and that most of that stuff is just like bureaucratic stuff. It frees up money. It frees up what they can do with the money. It puts on pause a lot of the kind of bureaucracy of submitting bills and submitting information to Medicare. And it really is just intended to be a relief of normal functions and focus on the problem. So that was a reasonably good choice. I think that another bureaucratic change was the CMS change, where it was all kind of in the context of the declaration of emergency, the federal declaration. It basically said, it didn't really change any regulations, but it just said, we're not going to prosecute anyone for HIPAA violations. We're going to pay for video visits on par with visits to the office. We encourage you to go out and do this. They actually specifically said, you can use FaceTime, you can use Google Duo. I can't remember the two that they said you could use, but they basically said, if you're using an end-to-end encrypted video chat system, you can do that, and we will count it as a virtual visit. That is something that was a huge shift in how we practice medicine. That has been an enormously difficult thing to get done, and they almost always pay significantly less. And there's a good reason for that. I mean, there's a huge risk of significant fraud, right? I mean, that's one of the reasons they don't let you do that. Well, right now we've just got to open it up. We do not want elderly people coming into medical offices.
Right. So
those are, I think, examples of the things that were well done. I think the emphasis on testing, because until you know where you are and until you can identify who's sick, you're lost. I mean, you're totally blind. And if you look at countries that did it well, and obviously I think South Korea is probably the paragon of who did it best. Partly because I think in 2015 or 16, they had an outbreak of MERS, Middle East Respiratory Syndrome, which is another coronavirus, but much more dangerous. So they, in relatively recent memory, had a similar type problem, and they had a game plan ready to go. And by the time we had our first test being licensed and produced, they were already making 250,000 tests a day or a week or something like that.
Wow.
No, I'm sorry, that's wrong. They had the WHO was sending out 250,000 tests. South Korea had 8,000 tests a day. They were doing 18 or 20 tests per million people. I mean, they were really, really doing a good job of figuring this stuff out.
Yeah, and I was reading an article comparing South Korea to Italy, and they were saying, huge differences in the population. Like a lot of young people got it in South Korea, where a lot of older smokers were getting it in Italy. But they also said, yeah, it's like totally different population. But they also were really clamping down and locking down people right away, and had they have the technology. South Korea is an early adopter in technology.
Yeah.
And so, I mean, they make a lot of it there. But I built a data center there in 2000, and they had video cell phones and video in their cars, right?
Right.
But the thing that I think is amazing is they had the ability to track people, to quarantine people, and to enforce it, where they were applying $8,000 fines to people. Like when people would come into the country, they would put them on 2-week quarantine. They would track you by your phone, and if you broke quarantine, you got an $8,000 fine, which of course, compliance is very high with those kinds of fines.
Yeah. Yeah. And that's the other thing about having testing. I mean, you can test all the people you want, but if you don't do anything with it, it's a total waste of time. So, and they actually never, I don't think, went into like a countrywide shelter in place order. I think they have not had to do that. They have had such good contact tracing through cell phone data and other apps that they just shut down the people who have had any exposure.
Right.
So they're really the model of how to respond to that.
Yeah, I think Taiwan, South Korea. I was going to say Japan, but it's funny. I was in Japan in February for a couple of weeks with some product launches and things we were working on. And I thought, I tend to think Japan's one of the safer places just because of the hygiene, the lack of touching, the number of things that they do there really well generally, and the way that they document health. I mean, when you go to any of the major international airports, you walk across 2 long mats of hygienic, that are wet with hygienic fluid to clean your feet and everything. They monitor your temperature coming to the country, et cetera. But I just learned, yesterday morning, I was on a 4 a.m. call with Japanese business partners, and Abe had just declared a state of emergency, and it appears that what they were doing was suppressing the information because they wanted to have the Summer Olympics so badly. Yeah. And so when we were going into lockdown, I was seeing all these social media posts from friends of mine in Japan, skiing, surfing, having dinners together, no masks, no covering, no social distancing. And unfortunately, I think they're dealing with the outcome of that now, which is, hopefully the state of emergency will control it quickly.
Yeah. Yeah. Well, one of the things that honestly I've been thinking about recently is the difference between the response, like the Wuhan response, which was pretty draconian and remarkably effective, but really only possible in an authoritarian country. And I guess at least having an example of South Korea as a representative democracy being able to manage this kind of problem. There are a lot of parts about, like if I were a middle-class Chinese person looking at the response of my government versus the response of Italy's government and the US government, and you'd have to honestly say, really? Is democracy that much better? So to me, it's actually very reassuring to have, we can do this, right? We just have to be smart about it. We've got to be aware of these problems, and we've got to utilize the mechanism of government efficiently and effectively rather than bumbling it.
Yeah, and I think too with we do a fair bit of business, a lot of business in mainland China. I have for a while, and I have a lot of different contacts there. One of them does a lot of work with Sinopharma, which is the largest Chinese pharmaceutical company, and he lives in Beijing. He moved to Phuket during this crisis, and one of the things that he has repeatedly pointed out to me is that yes, the lockdown was very effective and important, and the way that the Chinese responded with field hospitals and other things was really outpaced most of the world, and they have the ability to do that in China. But the data that we're getting out of China is probably quite suspect.
Totally.
We had a staff person from Shanghai in January who was able to visit Laguna for an event we had. And she told us that there were over 100,000 people already in Shanghai hospitals being treated for COVID symptoms. We were calling it coronavirus then, which was not being reported anyplace. And my friend in Beijing recently told me that, I said, so everyone's going, we know that people are going back to work, factories are being reopened. I said, does that mean that the curve's flattened and you're through this? And he said, the data is very suspect. They sort of think that at this point, the government's probably just thinking they've had enough people exposed to it that they can put people back to work. There are some restrictions still in place, but I think, all the data right now is, to one degree or another, suspect in a way, because there hasn't been a lot of testing. How people are reporting the data or reporting deaths is very different. Some people are reporting almost all the deaths related to COVID as a COVID death. Some people, like the Germans, are only reporting deaths that are actually directly related to COVID as COVID deaths. So I think a lot of the data is going to have to get cleaned up and correlated. And then I also think we have to look at whose data, who's counting the votes here, and how honest are they in what they're telling us.
Yeah, no, I think most of the things that I've seen about do we think China's doing, I mean, there are proxy things like, is Apple opening their stores again? Like, you look for things that you think you can trust the data, and do they really think, like, I agree. I think that and this was we were having this conversation about the WHO and is it beholden to China, and what, I don't really trust that the numbers China is necessarily giving me are true. I mean, I think that there's some utility in looking at them, but I'm not sure I'd make public policy decisions based on it.
At least not in the U.S. Maybe
right.
in China.
Right. Well, and I mean, that's a whole other kind of interesting question. I was listening to a podcast with, it was a podcast with a medical ethicist and an economist, and talking about what is the, how do they say it? Is the cure worse than the disease kind of problems? And so that equation looks really different if you don't value life as much, right?
Right.
And if you think that the value of a life is not as important, then even if you don't necessarily think that the yuan or the dollar or whatever is all powerful, the relative value of life makes that equation look really different. And so it makes it much easier for you to say, well, it's reasonable for us to open back up because the death toll will only be such and such. And it was interesting when that whole thing, I think it was the not Texas governor, but like lieutenant governor or something, was like, I think we should just let old people die so the economy can keep going. Old people are willing to die for capitalism, right? You're like, whoa.
Well, and what's crazy to me is typically the people saying that right now also hold very strong pro-life positions, but apparently not for old people, and apparently not if it's the stock market or their favorite cheesecake factory or whatever the fuck they're putting in front of a life. I was having, I have some private conversations about this with friends, and sometimes it gets a little off color, and we were talking about this exact issue. It's surprising, right? But one of the things I sent to a friend was, I said, if you were really going to be a terrible person, you would just look at the U.S. debt clock right now, and you would say, the best way to solve the U.S. debt clock is use herd immunity, because the two biggest cost centers for our country are Social Security and Medicaid, Medicare. Mm-hmm. And if you just unleash this on the country, it would wipe out a lot of those costs. But the cost of doing that is basically killing the population under 60. And, there's a reason most of us don't like Adolf Hitler very well. And it's generally because the way he treated, he had a plan. It was a terrible plan. And that plan was to basically kill the people he didn't like, or he thought were too expensive, or were a cost on society. And I think, as one of the great things about what America used to mean, or hopefully what it continues to mean, is that we do tend to hold life, very sacred, maybe only second to liberty. That's the one thing we'll trade human life for. And we certainly shouldn't be trading it for the stock, the Dow Jones average price, or the price of a stock, or our 401ks. I mean, those are things, particularly the younger people, we can get through that. We can rebuild. But what we can't do is we can't protect the people who are at risk if we unleash this. And I think a really good set of questions, hopefully that comes out of this as as this kind of thin veneer of civilization peels away, is maybe we start to see our shared humanity and stop arguing about these stupid, trivial things that have nothing to do with what we're really here for, which is hopefully to love each other and support each other. Yeah. Do you have any thoughts on, yeah, go ahead. Yeah.
The other really at-risk population, I mean, brown-skinned people, there's a ton of data coming out of New York and out of Detroit about how minority communities are just getting walloped by this.
Why is that?
I think some of it is just, I mean, there are probably lots of reasons. One of the stories coming out was that there's this whole thing going on in the Detroit area about water, right? And the Detroit Water Authority and Flint, and that all was kind of because of this water supply. There are a lot of people with back bills, and they're getting their water turned off. Well, how do you wash your hands for 20 seconds if your water's turned off?
Right. It's the same problem on the Navajo reservation. There's Navajos, they were interviewing on NPR a Navajo man who has to go and hand carry water to their home. And when you think about washing your hands for 20 seconds and discarding that water, because they reuse a lot of the gray water, I mean, the man was weeping. He was like, I don't know how to do this. I don't know how to carry that much water. And the Navajo population is getting completely, I mean, it's really sad. They're getting wiped out right now. I think they've had about 1,000 reported cases and 154 deaths, which is one of the highest percentages of deaths I've heard of. Unfortunately, they also had a mass Pentecostal prayer meeting like a week ago, which, so there's some compounding factors there. But I think to your point, look, if these are communities where they're living in, an urban center, maybe they're living in close proximity because of that. There's less independence because of some of that. There's a lot of things that are going to compound and create difficulty for those populations. Do you think it's primarily social issues, or is there some issue with kind of the DNA or the makeup of the person that's causing an issue?
Well, I mean, I think it's probably a little bit of both. I think most of it's social issues. I mean, I think that there was a story in the New York Times about how the subways are full. Well, the subways are full of people who need to get to work. I mean, who is it that you think cleans the hospitals?
Right.
Who is it that you think does the laundry in the hospitals and serves the food in the hospitals? They're not getting N95 masks to run on the trains. They don't have cars. That's how they get to work, right?
Right.
So some of it's social, some of it is lack of health care, right? Those are the populations that don't have health insurance in good times. And so their diabetes is poorly controlled, and their hypertension is poorly controlled, and their asthma and their COPD is poorly controlled. They tend to have higher rates of smoking and vaping. It's very hard to be a healthy person if you're living on the margin. And so they're more susceptible, and just because of where they are. Like for me, I mean, my income is going to go down pretty significantly eventually because I'm not producing. But I'm not worried my kids are going to eat, right? I mean, I have enough of a cushion so that I'm safe. I have a warm house. I know I can procure enough food to keep us fed. What is it? 40, 50% of the population can't sustain a $400 charge.
Right. Well, there's a lot of kids in our school systems that rely on the school lunch program and breakfast program to be fed every day. I think
50% of the kids in Holland public schools are on free and reduced lunch.
The number of people on food stamps is remarkable, not in people of all colors. And I think to your point on this, if we think about rebuilding a country, I think a big discussion needs to be, how do we keep people out of grinding poverty? How do we break the cycles of grinding poverty? How do we help people get control of their lives? And how do we do it in a way that encourages people also and empowers people to go and build the life they actually want, rather than being stuck in some, social program? I think that combination is really important. Do you have any ideas on maybe how this might help us be better human beings and build a better, typically out of these big kind of existential crises in America, whether it was World War II or some of the other, things that have happened, we've come out and built something better. Do you have any ideas on what we might do that would create a better country or better nation?
Well, it would certainly help to have someone who thought that was I mean, again, I tried to be very positive about the things that have been done. I think the direction that the national conversation is largely follows our leaders. And at the moment, I am appalled at the lack of some compassion and the lack of some, out in front proactive view of a national identity and a national coming together to work together. I have my biases about Donald Trump, and I find him to be a big source of the problem. And I think we're doing all right despite that fact. But I think that to me, it is very important that we talk about institutions as being incredibly helpful. Yes, they are incredibly frustrating at times, but institutions are invaluable. I mean, it's the whole reason we have societies. If we don't have institutions, we're hunter-gatherers, right? I mean, the whole point of it. Now, certainly that can run amok and that can cause trouble, and history is rife with examples of that. But I think, focusing on what institutions can do well and enabling them to do it makes a ton of sense. Focusing on how we plan for things, how we value preparedness, right? Preparedness is a choice. We have had epidemic outbreaks in the past, and we'll have them in the future. It just flabbergasts me that we didn't have a kind of on the shelf outline for what kind of rescue package we would need to have. I mean, we basically, I don't know. I mean, I'm not a politician and I'm not an economist, but it strikes me that we dipped into the same well of, tax breaks and subsidies for industries. I mean, why we're subsidizing the cruise industry right now with this $2 trillion bill just makes no sense to me. Why we're giving the airlines money, almost the exact same amount of money that gave them before, all of which they spent on stock buybacks. Why we're not coming up with well, I guess I shouldn't say that. I know why we're not doing it, because there are special interests. There are interests in it. But I think having a preparedness plan for something like this, to say, this is what you've got to do first, and then taking it seriously, right? I mean, there is a preparedness plan. It was put together kind of in the wake of the Ebola crisis. And somebody once was telling me about how, oh my gosh, Bill Gates gave this TED Talk in 2015, and he was so prescient. Nobody else saw that. And I said, no, a lot of people
did. Yeah.
Public health people have been saying this for a long time. Like, we all know this is a problem.
And when Bill Gates is saying it, that's because his nonprofit is working with a lot of these people, funding this work because it's so important. And he's just basically consolidating that information into a TED Talk that people will listen to because he's Bill Gates, which is wonderful. But it's not like Bill Gates invented this any more than he invented, the object-oriented operating system.
Right. Well, and we had this plan. There was a 69-page document that was designed around how does the federal government use its resources to respond to an airborne flu-like outbreak, and we didn't follow it. I mean, we don't, and it's unclear as to whether the current administration just didn't know it existed or they just didn't like it. Their claim now is that they think, oh, this was dated and it wasn't useful, and we've got a better plan. But clearly, it outlines you got to get protective gear set up. You've got to get testing set up. You've got to get all of the states on board and implementing this and distributing that stuff. And I mean, it's all kind of easy to say now, but in the fog of it all, it's confusing, right? You need a game plan when it's confusing. And we should be laying that all out and saying, look, this is the package. Break this glass the next time you hear somebody say SARS, and do what we said, right? We're not fucking around about this. So, I lost you, Dave. Can you hear me?
Yeah, I can. Sorry, I'm muted. Also, I think if you look at New Zealand, right? I mean, smaller country, but still 5 million people, 6 million sheep. If you look at, they have a young female prime minister. We don't count hobbits. They count as 2/3 of a person.
Oh,
But if you,
that's rough.
that's a terrible joke.
It's 3/5.
It's 3/5. Sorry, yeah. No, those are terrible jokes. But hobbits count as a whole person. But what, they have a young female prime minister who doesn't have a lot of ego wrapped up in her job, and they got very proactive on this. They locked down the second they started to see any cases. They've been very strict about it. They've squashed the curve before it even got to close to a normal apex. And, they think they're going to be in a place to start moving about again socially in a couple weeks. We'll see what happens there. We don't know. But I think they've seen their cases already declining.
Right.
They've moved through this quickly. They will have to behave differently than they were in the past. We all will, I think, until we have vaccines and antibody testing. Well, actually, I should ask you if you think that's right. But it's just, I think it's remarkable when you see people do it right. It helps us think about how we could have done it differently.
Yeah. Well, I mean, she's quite an impressive leader.
Yeah.
I think on a number of different fronts and in response to a number of different events, she has really shown an incredible ability to just say, look, we got to get this done and do difficult things in response to really horrific situations. And I think you're absolutely right about that. You're absolutely right about the vaccine and about serologic testing and about, if you look at the difference between our capacity to deal with problems in 1918 versus now, they sequenced, I think the first cases were in December. The first was sort of identified virus was in January 6th. By January 12th, they had the RNA isolated and sequenced.
Right. Amazing.
It's incredibly fast. Now then, of course, what ended up happening was they didn't share any of the viral particles. So we had the RNA sequence, but we didn't have testable material to work with. And again, that's politics, right? There was a problem where the CDC didn't have their person on the ground in Wuhan anymore because that person's job had been eliminated. And then our government wanted some of this stuff, and Chinese government refused. And so somebody went to an academic institution to try and China put the kibosh on that. And it was just ridiculous. And it's all because of pre-existing stuff.
Because of a dumb trade war, basically.
Yeah.
Trade wars which never help anybody. So do you think, I'm just getting, because of our global relationships, I'm just getting antibody tests this week, like instant at-home antibody tests that we're looking at, either giving away or figuring out how to distribute. In different countries have different regulations on those. In Europe, we can sell them over the counter or give them away with a purchase or do different things. What do you know when in the United States, have you heard any, when we might have antibody tests available here?
I believe we have approval for antibody tests. I don't know if they are in play right now. I know I've seen approval for, I can't remember what company, if it's Abbott Labs or somebody has a serologic antibody test.
I think it's BD. Yeah, BD is doing some with, they're doing a test. I think they're testing everyone in Ski Town in Colorado, Telluride, which makes me want to move. Gives me another reason I want to live in Telluride.
Exactly.
But I think it was a small population they could do quickly that had gotten hit hard by the virus. And of course, they're doing it in China. They're doing it in Italy. I think Italy's they're buying hundreds of thousands of tests a week right now, these tests.
Yeah.
But I'm assuming we're going to be getting them throughout the United States quickly. I just hope it happens fast.
Yeah, I think a lot of it'll depend on, that brings up a whole other question of, once you have immunity, are you immune to SARS-CoV-2, which is what this is now officially scientifically called? Part of the problem is there's already documented genetic mutations. If you look at the sort of index cases going to Europe and then going to USA and Southeast Asia, there are already documented genetic changes. So one big question will be, does this confer broad immunity? Does it confer sort of a partial protective immunity? What about vaccines? I mean, there is a MERS vaccine, so and I think it's theoretically good for 2 to 3 years. So you might need boosters and that kind of stuff.
Yeah. Which brings up a whole conversation about vaccination.
Yeah, it sure does.
Maybe we won't go there today.
I think we can go there. I just don't want to see the comment section afterwards.
No, it's okay. We can go there. I mean, at this point, if people don't believe, I mean, what do you think what's the real heart of the criticism of vaccines when people are anti-vax today in America, given the body of knowledge we have? I mean, what's the...
I think it's a lack of historical knowledge, and I think it's a predisposition to conspiracy. I mean, the idea that this is all based on the desire to make a bunch of money. I suppose that's true, but there's nothing necessarily wrong with making money.
What does that mean? You suppose it's true?
Well, I mean, drug companies and vaccine companies want to sell their product and make money. So is there a bias towards having routine vaccination? Yeah, I mean, I guess there is, but the thing is, that's not, I mean, it's kind of like saying science says smoking causes cancer. I mean, we know it does. Like, I don't need to wonder if, the companies that make steroid inhalers for COPD are biased in suggesting that we should keep people from smoking. I have public health data that says that's true. People, honestly, there was a big debate about whether Franklin Roosevelt in the Roosevelt Memorial in Washington should show him in a wheelchair. He did not want to be seen in a wheelchair ever. Like, right. That was a whole thing. A lot of people, I think, honestly don't know that we had a president who had polio.
Most people have never, well, I mean, I guess my dad had a friend that had polio, but most people living today haven't seen a polio epidemic.
No, good Lord, no. Are you kidding me? Haven't even heard of a polio epidemic, right?
I mean, how would a polio epidemic compare to this epidemic, this pandemic?
Oh, I'm not sure I have that information. I think they were equally scary. My suspicion is that was also profoundly dangerous. I mean, an iron lung was designed because you couldn't breathe, right? I mean, an iron lung was how they kept polio people breathing, because we didn't have long-term ventilator use, and it was a disaster.
Is that what they were referred to, polio people?
I'm not sure.
I'm joking. So, no, I mean, it seems to me like, when I've talked to people who have, concerns about vaccines that are semi-rational, I mean, one of the concerns is that, there's mercury in a vaccine, and I think they're referring to multiple use vaccines, which aren't used on children anymore. Basically there was trace amounts of mercury in some of the preservatives in multiple use vaccines, but that hasn't been true, I don't think, for a decade. Yeah.
Yeah. They got rid of that so long ago that it's kind of a non-issue anymore.
Right.
In addition to which, even when they had it in there, there's really no proof that has any demonstrable concerning effect. In addition to which, the whole thing about, does it cause autism, right? There's a website that says, it's www.dovaccinescauseautism.com.
So it must be true.
What's that?
So it must be accurate.
No, you open it up and it says, they fucking don't. It just says that in big, bold print.
Just for clarity.
Right. Well, but the thing is, the problem that I think happens is we focus on the thing that we think we can manage. Right. And so Jenny McCarthy says, my kid got a vaccine and 3 days later he started being autistic. Well, 3 days later he might have been diagnosed as autistic, but it clearly develops as toddlers age. But you also haven't thought about all of the chemicals that are under your kitchen sink.
Well, or how old was the father that gave you the sperm for that child? Right. Well, no, because this was in Science Magazine.
Oh, I thought we were impugning Jenny McCarthy.
No, well, but in general, they said, look, the age of the father who's contributing to that child has a direct impact on the number of cases that develop into birth defects, including autism. or kids on the spectrum. And of course, nobody wants to talk about waiting to have kids till they're later, because that's something we choose to do and we want to do because we live in a wealthier society.
Yeah.
But we want to blame something that we don't have control over. I think it seems to me that's part of the equation, anyways.
Right. Well, I'm not a public health expert, and when I'm given the opportunity for my children or me to have vaccines, I generally say yes. I think there honestly is a scientific debate about should we be doing mandatory influenza vaccinations, because I think the science on that is not probably quite as firm. I mean, like polio vaccines are, I'm not a big one for miracles, but they are the miracle of modern medicine. I mean, they are the reason, it's the reason we've got, 9 billion people on the planet in the next 10 years, as opposed
smallpox,
to one.
Polio, measles. I mean, many of those diseases had been nearly eradicated or were eradicated.
Right.
Do you think, how about the grouping of, one of the things that, that's come up is that when kids have a lot of vaccines at the same time, that may be problematic. Do you think that's true or not?
I don't know enough about the data on that. I mean, I guess I don't have a reason to believe that it's a problem, because there's been no public health data to say that it is. If people feel strongly that that's the dangerous factor for their kids, I guess if it's enough to get you to vaccinate your kids so that we don't have outbreaks of pertussis again, that I think I'm okay with that. But again, it's a lot of vaccines. If you stretch it out long enough, you're going to have kids going to school who haven't finished their regimen. So
you also have to get the entire population to come through a doctor's office multiple more times than they would if you group them together, which is right. So now you're weighing like some of the outcomes versus the, versus actually getting the population vaccinated.
Yeah. I mean, I'm not an expert in vaccine policy. I think as a general public health principle, I think it is an invaluable resource. I think that you can have a discussion about the speed of the regimen, but I think now we're kind of splitting hairs. I think my real concern is when people are saying I'm anti-vax because I think I should have freedom, or I think I should have, the problem is it only works if we do it together,
Yeah. And that's about having a country and having public health and having a safety net that includes, better practices. It's the same reason you can't go shoot your gun off in your neighborhood. I don't know what you can do in Michigan. In California, we can't.
I was like, wait, what? I can't? Hang on. Chris Romance is going to be very disappointed.
Yeah, my cousin, who's a wonderful guy.
That was a whole other area of kind of debate. I mean, the South Korean model of using testing data to do tracking, symptom tracking, movement tracking, all of those things, that's a really thorny issue. Like, you're potentially giving the government an awful lot of data about where you are, what you're doing, if we're going to implement that. And how do you say we're comfortable implementing that in an emergency and then being comfortable that they're not going to use it for anything else? I mean, that's a totally reasonable debate. I think it's kind of a moot point now because it's kind of after the fact, but it is something we ought to talk about. Should we have an app or some sort of mechanism that only HHS can use, and it's sort of legally prohibited from infringement by the FBI or the CIA, and just say, look, as a matter of public health, we need to be able to get to this data, and it is a punishable by death crime for you to use this for law enforcement or whatever.
Well, I do think you could treat it like a HIPAA violation, right? The Health Information Patient Portability Act really protected your patient information at one of the highest security levels, almost like your banking information. And so there was a really good article that a friend posted on my Facebook page yesterday about, looking at CCTV and other security camera information that's now being compiled, and particularly when you're in Europe and Asia, the breadth of coverage that these cameras have and the way that government surveillance can see what's really happening is pretty profound, and it's changed without a lot of people really knowing it. There's artists who are actually hacking into it and doing art with it, which is kind of interesting. But But part of what they were talking about was, now we have, watches, phones, other different wearable devices that track our temperature, our heart rate, our behaviors, all kinds of health information, which can be really useful in a pandemic, or to predict where a pandemic is striking, so you can close down whole areas rather than, you can kind of surgically focus on locking down areas rather than having to close down the whole country. But I think the great question is, who has access to that? How are they using it? What's the intent? And how do we protect? Because inevitably, if it's free access, it's going to get abused. That's what people do. And I think the question is, how do you protect people and protect liberty? Taiwan might be one of the best examples. They have one of the highest freedom indexes in the world, higher than the United States. And, they really manage this well. And I think it's that there seems to be like a cohesive Asian model of government that it really understands liberty and community in a way that might help us.
Yeah. Well, I think I don't do a ton I don't do a ton of business or health or anything in Asian countries, but my understanding of it is that it's a very communal based, family oriented. I mean, the whole reason their last name is first, their surname is first, because they value the family and the community above the self. And you only have to walk around America to find out that we value the South above all else.
Right.
And that's great for normal times, but it's a real problem when you need the community to work together and act together. So.
Yeah, and I think that's where we're at now. Well, I really appreciate you taking the time today, Joe. I thought you'd have a valuable voice. We have some great conversations offline. I always, you spend a lot of time thinking about this, reading about it. You have to practice it. You have to practice health. You do touch public policy and health as part of your work. And, I know you have a lot of great training and you have a great medical practice, and I appreciate you taking the time today to share some of your thoughts. This is very helpful for me, and I hope it's helpful for our listeners.
You bet. It's always good to talk to you, man.
Thanks, Joe.